this week, bringing hopes to the end of the pandemic in the near future. Meanwhile, in Germany, vaccination plans have accelerated, but with no fixed date yet, as the country struggles to tackle the second wave. DW's Emmanuelle joins us right now with an update. Emmanuelle, probably we would like to know why the UK has had the chance of being the first to be served with the vaccine, if I should call it that. What explains this?
Well, the UK is the first country in the Western world to roll out a vaccine, but Russia already began vaccinations with Sputnik 5 vaccine, their vaccine, and China also has a vaccine for its population. But this is the first time a vaccine that has gone through the late stage trials is being used. The British regulators approved the BioNTech Pfizer, which was developed here in Germany, shot on December the 2nd, and the UK received 800,000 doses of that vaccine, which allows to vaccinate 400,000 people. Now, there's a vaccination plan that sees people over 80, so the elderly being vaccinated first, in care homes first, in hospitals. They will be followed by nursing home workers and by vaccination staff.
Well, speak to us about Germany in particular, its vaccination plan and how this is actually going to be rolled out.
Well, the German Health Minister Jens Spahn said that 3 million doses of vaccines will be available in January. Now, why January? Well, it needs to be approved by EU regulators first. That should happen in the coming days, in the coming weeks. Chancellor Angela Merkel spoke about 70 million doses of the vaccine available during the first trimester of 2021. That's enough to vaccinate around 35 million people. In total, Germany, via bilateral agreements, via EU Commission, ordered 300 million doses of shots. They will be shared between BioNTech Pfizer shot and the Moderna vaccine, which had been developed in the US. This is enough to vaccinate its own population, but also to redistribute it to other countries. And here in Germany, we'll see 2 phases in the vaccination campaigns. There's 60 centers, vaccination centers that have been set up all over the country. First to be vaccinated will be the elderly, then hospital personnel. And once the vaccine production will have caught up and be more broadly available, then the general population will be able to be vaccinated.
Well, Emmanuelle, if you could highlight for us, and so that we understand the media reports that the pandemic is far from being under control in Germany, the reason for this, and of course what the government is doing to address it.
Well, you know, since early November, we had a so-called light lockdown here, and this has failed to deliver good results. The virus is spreading more broadly, there's too many hotspots, and the vulnerable population is most affected this time around. I'm thinking about the elderly in particular. The figures are way too high, and today, Germany recorded its highest number of COVID-19 related deaths, 590, and more than 20,000 new infections. And on average, the 7 days incidence rate is 3 times higher than what it should be, with 150 cases per 100,000 inhabitants. There's more and more calls, both among the population and within the government, for a tougher lockdown. The worst affected regions, such as Bavaria, such as Saxony, have already implemented, tightened their measures. There's more restrictions that should follow. Berlin, for example, there's talk to implement more restrictions, but only after Christmas in the German capital. Now, time and again, Chancellor Merkel has said that we needed a tougher lockdown. She said we can't only rely on hope to tackle this pandemic, but most measures are up to the regions to implement.
Emmanuelle, from our partners, DW, thank you so much as we keep following the COVID-19 pandemic and the COVID-19 vaccine news. It's live at 1. Let's take a short break and return with more.